From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Nick Oresco. October is Breast Cancer Awareness Month, the annual campaign created back in 1985 to increase awareness of this disease. While both men and women can be diagnosed with the disease, according to the CDC, breast cancer is the second most common cancer among women in the United States. And black women die from breast cancer at a higher rate than white. This week we will have two programs discussing prevention, diagnosis, and the latest treatment options available for breast cancer. In the first half hour, we'll be learning about the Mass General Cancer Center at Cooley Dickinson Hospital, and in the second half, we'll be talking about what breast cancer treatments are available at Bay State Health and this year's Rays of Hope Walk. Starting off today's program, I am joined by Glenda Flynn and Lauren Pack, nurse practitioners with the Mass General Cancer Center at Cooley Dickinson Hospital. Thank you both for being here today.
Thanks for having us.
Okay, so let's get right into it now. Easy question, but a basic question. What is breast cancer?
Do you want to take this one?
Sure. Breast cancer is the abnormal growth of cells that continue to grow and divide unchecked, and they form a tumor. With breast cancer, these cells are initiated within the breast tissue.
What are some of the symptoms that, of course, not only men, but especially women should look out for?
So when breast cancer is developing, women should be aware of any new lump in their breast, any asymmetry in the breast or puckering of the skin, particularly when they put their arms in a raised position above their head, scaling or redness of the nipple, redness of the skin of the breast that looks almost like an infection. Pain can be a presenting symptom, but is not commonly associated with cancer. So it's thickening of the breast, changes in the skin, changes in the nipple, and any kind of dimpling.
And when you see these kinds of symptoms that you just described, what are some of the risk factors involved?
We think of risk factors in two different categories, those that are modifiable and those that are unmodifiable. Our modifiable risk factors are those such as lifestyle, so things like alcohol intake, diet, exercise, as well as our exposure to things such as hormones, such as birth control pills. Unmodifiable risk factors are things such as age, female gender, as well as a personal history of breast cancer or a family history of breast cancer, any genetic mutations, as well as someone's reproductive history. So if someone has early onset menses or periods earlier than the age of 12 or late menopause after the age of 55, all of these things can increase one's risk of developing breast cancer.
As I mentioned earlier, a report found African American women have a 31% breast cancer mortality rate, the highest of any U.S. racial or ethnic group. Why is there such a poor outcome among that demographic?
Well, we think that this is related to the fact that they are often diagnosed at a younger age with a more aggressive type of breast cancer. But there are many there are many factors that can actually contribute to poor outcome in African American women, which of course can include socioeconomic factors, as well as access to screening or health care. And one of the things that we often don't talk about is that much of the research that we use to diagnose and treat cancer of all kinds is based on research that has been done on Caucasian people. And so when we're treating African American people in the way that we've established is the right care for Caucasian people, their cancer may be a little different from the types that we've done research on, and that can, of course, impact the outcome of the treatment.
When we think of breast cancer, I think most of us think of women, but how common is breast cancer in men?
In men, it's estimated in the United States and in the UK about 0.5 to 1% of men are likely to develop breast cancer within a year, or the American Cancer Society estimates that a man is likely to develop breast cancer 1 out of every 833 persons.
Now, you mentioned the symptoms a little bit earlier. What are the latest technologies in screening and diagnosis, and especially the treatment once you see those symptoms occur?
Well, there's not a lot new in regards to screening for breast cancer. Mammogram is still the gold standard, and my recommendation is annual mammogram for women. You can, of course, also do breast MRIs or ultrasounds, and they have very specific uses. New targeted therapies and immunotherapies are constantly being introduced as far as treatment is concerned. So as oncologists and as nurse practitioners, we of course have to stay abreast of all of the new treatments that are being developed daily, monthly, to be sure that we're providing the most up-to-date care for our patients.
Now, when someone goes for testing, what are some of the questions that they should be asking their doctor, and what information should a patient expect?
So in terms of testing, whether it be an imaging test or a lab test or a procedure, it's important that the patient understands why it's being done. What is it that we're looking to get out of this test? What are the risks associated with the test? The benefits of the test? Is there any alternative to the test? And then after we have the results of this test, it's important that the patient understands what are the next steps, what is the treatment at this point.
All right, well, great information there. When we come back, we'll be discussing diagnosis and treatment options offered at the Mass General Cancer Center at Cooley Dickinson Hospital. You're watching 22 News in Focus. And welcome back to 22 News in Focus. Today we're talking about breast cancer awareness and what you need to know about the latest diagnosis, treatment, and prevention care with Lauren Pack and Glenda Flynn, nurse practitioners with the Mass General Cancer Center at Cooley Dickinson Hospital. All right, let's get back into it, ladies. So how is breast cancer diagnosed?
So breast cancer is initially identified either on clinical breast examination, where a trained provider finds a change in the breast that's concerning. And then imaging is done, which usually starts with a diagnostic mammogram, and an ultrasound may follow to better look at an area of concern. Once the area is identified as having concerning characteristics, then the patient is moved forward to a biopsy, and the determination is made by the radiologist as to what approach for the biopsy is best, which can either be done in the hands of a breast surgeon or in the hands of a radiologist under ultrasound guidance, or in some cases mammogram or MRI guidance.
Yeah, you mentioned some of these tests. What are some of the most effective tests, though, for detecting and diagnosing breast cancer, at least what patients should maybe be asking their doctor?
Absolutely. We have 3 different imaging modalities to best detect and diagnose breast cancer. The first, like Glenda mentioned, is our gold standard, the mammogram. There are 2 types of mammograms, which Glenda alluded to. The first is a screening mammogram, which is performed on patients who are asymptomatic, and this includes 2 views of the breast, a top aerial view of the breast as well as a side view of the breast. The second type of mammogram is a diagnostic mammogram, and this is performed on someone who has a breast concern. The difference in a diagnostic mammogram is that there is a reading radiologist present at the time. That radiologist is able to obtain additional views to better characterize the mass or abnormality, and they can also request an ultrasound at that time, again, to better characterize. Ultrasounds are also better for younger population of women because abnormalities are less likely to be detected on mammograms for women, typically less than the age of 30. A breast MRI is great at looking to further characterize an abnormality that is seen on a mammogram or an ultrasound. It's also used in patients who are at higher risk for developing breast cancer, who have a family history or a genetic mutation. One note about the breast MRI is it is highly sensitive but not specific, meaning it can detect a lot of false positives, leading to a lot of anxiety and potentially biopsies that are unnecessary. So it's important that the patient have a discussion with the provider about what is the best test going forward.
Now, I'm sure once someone is diagnosed with breast cancer, there are a lot of thoughts going into their mind, a million miles a minute. What are the next steps for determining the best course of treatment?
So first off, the woman or man who has been diagnosed with breast cancer should seek out a team of care providers who can speak with them and talk about what the best treatment options are. And that's usually a multidisciplinary approach, meaning that the person will meet with a breast surgeon, a medical oncologist, a radiation oncologist, in some cases be referred to a hospital that is doing clinical trials. And once they've met with those people, they can then make a decision based on the standard practice or standard of care, whether chemotherapy is best first or surgery, and they can move forward from there.
So once treatment has begun, who is involved in a patient's treatment team, and how often do they meet to discuss the patient's progress and make any changes?
That's a great question. Like Glenda mentioned, it's a multidisciplinary team that is involved in the patient's care at this point. And not all breast cancer treatment is the same, so each treatment is going to be different. From a medical oncology standpoint, your team is going to consist of a medical oncologist, a physician, nurse practitioners like Glenda and myself, as well as nurses. In terms of how often a patient is seen is really going to depend on the specific treatment, but typically what a patient can expect is to see a physician upon diagnosis and a nurse practitioner and a physician spread throughout their treatment course to make sure that they are tolerating treatment without difficulty. We don't need to tweak any sort of medication and that it's safe to continue.
Now, of course, you have the doctors there, you have the nurses there. Is the family or other caretakers involved as well?
It is vitally important for a person's family to be involved, and I'm using family as a broad term. So family might be a group of friends, it might be what we would consider the nuclear family. It's so important to include the family because having the family there for emotional support is very important, but also having the family involved in the decisions helps the patient to feel like they're making the right decisions, and also the family can help them get through with side effects, remember medications, get to appointments on time, and so forth.
What are some other recent breakthroughs in breast cancer treatment, and what are being used right now?
Well, one recent study that was recently published in the New England Journal of Medicine looked at what's called the Keynote 522 study. And what they saw in this study is patients who received, patients with early stage triple negative breast cancer who were treated with chemotherapy plus immunotherapy had better complete pathological responses versus patients who were treated with chemotherapy alone. This study is groundbreaking in the breast cancer world and something that we're starting to utilize in practice at Cooley Dickinson.
Which is some great news there. Okay, so what happens after recovery? We'll find out after the break. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been talking about breast cancer diagnosis and treatment options, but what's next after treatment is done and cancer is in remission? Once someone has completed treatment and is in remission, what does a follow-up plan consist of?
Well, once someone has completed treatment, they go on to what we call active surveillance, which means that initially it really depends on the type of follow-up treatment that they may need. Some women go on hormone manipulative therapy, and they're followed a little bit more closely because we want to make sure that they're tolerating the medication well. In that case, we might see them every 3 months for the first 2 years, and then every 6 months for a few years after that. Normally, the frequency with which they come in to see us drops down to once a year after 5 years, but in some cases the post-care is determined based on the amount of anxiety that a man or a woman has about cancer recurrence. Some people, for example, prefer to come in more frequently for breast exams, and some people are completely okay coming in every 3 to 6 months.
Talking about the center at Cooley Dickinson Hospital, does that center offer any aftercare programs?
Yeah, their partnership with the YMCA as well as the Livestrong Foundation in programs such as Weight Watchers, patients can access these programs to help ensure that they are living active, healthy lifestyles after their diagnosis. The Cancer Connection Center is also just across the street from Cooley, and they offer a wide range of supportive services as well.
Okay, so let's talk about prevention now. Is breast cancer preventable?
Well, as Lauren was saying before, there are actually modifiable risk factors and non-modifiable risk factors, and that means that in our lifestyles we can actually make changes that could help prevent breast cancer, but there are some things that we can't control. So the answer to that question is breast cancer may or may not be preventable based on our lifestyle and risk factors. Now, the lifestyle changes that we can put into place include maintaining a healthy weight, exercising regularly, avoiding alcohol, and avoiding long-term use of hormones.
How much does family medical history play a role in breast cancer?
Family medical history plays a large role in breast cancer. Particularly what we're concerned about is someone who has a first-degree relative diagnosed with breast cancer. That means mom, dad, sibling. A person with just one first-degree relative has a twofold increased risk of developing breast cancer within their lifetime. And if a person has two first-degree relatives diagnosed with breast cancer, their personal risk increases threefold. So it's something that we certainly want to know about to help assess and create a plan going forward for surveillance for that patient.
I want to talk about the BRCA gene. Should women with a family history of breast cancer be tested for this?
Well, BRCA is actually an abbreviation for breast cancer gene. And there are actually two BRCA genes, BRCA1 and 2. When people have this type of genetic mutation, it can increase their risk for developing breast and ovarian cancer. But we think that only about 6% of people who develop breast cancer develop it because they have this genetic abnormality. The reason why BRCA1 and 2 are so important, though, is that people who have BRCA1 genetic mutation, for example, have a 72% lifetime risk of developing breast cancer, and people with BRCA2 mutation have a 69% chance of developing breast cancer, as opposed to the 1 in 8 or 9 women who will develop breast cancer despite not having any genetic abnormality at all.
So if someone tests positive for that gene and does have a family history, should they consider having a mastectomy as a preventive option?
That is a really complicated question. A lot goes into making that decision, personal reasons, personal factors, and we really recommend having a conversation with a medical oncologist along with a genetic counselor to determine if and when something like a mastectomy or a hysterectomy is recommended in that patient.
While breast cancer is rare in young women, it does happen, unfortunately. At what age should women begin getting a mammogram?
Well, we think at this point that women between the ages of 40 and 49 should certainly have a discussion with their care provider about starting to have mammograms. And right now the guidelines indicate that women aged 50 to 54 should have annual mammograms. Women over the age of 54 should have annual mammogram, or they might consider having mammograms every other year. I recommend that women continue to have annual mammograms until such time as they have medical conditions which would shorten their lifespan, or they're elderly and have a life expectancy of 5 years or less.
And again, I'm sure it's scary to hear the word cancer. You do have breast cancer. What advice do you have for newly diagnosed breast cancer patients?
Receiving a breast cancer diagnosis can be extremely overwhelming and can evoke many emotions such as anxiety, fear, even disbelief. We at Cooley want you to know that you are not alone. We are here with you to create a plan to make you feel safe going forward. Anything to add to that?
No, I think you said it beautifully.
Okay, well, I'll have some final remarks after the break. You're watching 22 News in Focus. You've been watching 22 News in Focus. Today, we've been discussing breast cancer awareness and the most effective diagnosis and treatment options offered at the Breast Center at Cooley Dickinson Hospital. Thank you to Glenda and Lauren for being here on the program and sharing all of your expertise. And thank you at home for watching. If you missed any of it, you can watch it in full on our website at wwlp.com. From all of us here at 22 News, have a great day.
From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Nick Oresco. October is Breast Cancer Awareness Month. 22 News in Focus this week is offering 2 half-hour programs dedicated to breast cancer prevention and treatment right here in our region. In the first half hour, we spoke with health professionals from the Mass General Cancer Center at Cooley Dickinson Hospital, and now we are talking with a breast cancer specialist from Bay State Health. We'll also have information on this year's Rays of Hope Walk and Run fundraiser, celebrating its 29th year. The technology around diagnosis and treatment for breast cancer has made incredible improvements, increasing survival rates for all types and stages. Joining me to discuss the latest diagnosis and treatment options is Dr. Ann Friedrich of Bay State's Division of Surgical Oncology and Breast Specialist. Doctor, thank you for being on the program today.
Thanks for having me.
So what is the definition of breast cancer?
So breast cancer is basically the development of cancer within the breast tissue, originating from the breast tissue. And in order to understand what that is, it's important to understand what cancer is. Basically, in general, cancer is the uncontrolled growth of a certain type of cell that lives inside the body. And breast cancer is the growth of such a cancer within the breast, originating from the breast tissue.
Is there more than one type?
Yes, breast cancer can be differentiated in many types. One of the ways to differentiate it is by originating tissue. So the breast is made of lobes and ducts and in-between tissue, and the lobes are technically supposed to produce milk, and the ducts bring the milk to the nipple, and breast cancer can come from either the lobes or the ducts. But there's also other types that come from the tissue that's in between the lobes and the ducts. And then there's rarely other types of cancers that can be associated in the breast as well that come from other parts of the body. There's also skin cancer that can be associated with the breast.
So many types. What are some identifying symptoms?
Classically, breast cancer actually doesn't produce a lot of symptoms at all. Most of the ones that we find on screening mammography. But when patients do get symptoms, they tend to notice a mass in the breast themselves on breast exam, or maybe their partner feels them. Another way that one can detect breast cancer is by noticing a visible difference between the two breasts, such as new dimpling or redness of the skin or scaling of the nipple or asymmetry that wasn't there before, and sometimes a mass can even be visible.
What are some of the risk factors involved, and what kind of role do they play in developing breast cancer?
So the biggest risk factors for breast cancer development are older age and female gender. And the third big risk group is a patient with a genetic mutation. And there are many genetic mutations that we know of now, and I predict that there will be more that we will be discovering in the future. Besides that, there are minor risk factors for breast cancer development, such as estrogen intake, earlier onset of menstruation or later menopause, late pregnancy, or lower years of breastfeeding in the patient's history. And some lifestyle factors are there as well.
And what are some of those lifestyle factors?
So those are really interesting because you can change those to reduce your risk somewhat. And among those, we have things such as weight. It's recommended to keep a healthy weight, and along with that goes a healthy diet that's well balanced with fruits and vegetables and protein. The other important thing is to decrease estrogen that you would take in, such as in menopause hormone therapy, to minimize that as much as possible, even if it is necessary. And the other factor is to minimize alcohol intake and stay away from smoking.
And I know there's not a lot you can do to prevent breast cancer, but how much does family medical history play a role in that?
So that's a big risk factor as well, and it's good to know your family history. Not only because a certain type of family history can make us suspicious of a genetic mutation in the patient's past, but also because of the random breast cancers that can happen within the family history. Those can increase your risk of getting breast cancer as well. And some patients, even the ones that had negative genetic testing and don't have a high-risk genetic mutation, might still be at a very high risk of breast cancer development in the future, simply because of the number of family members that had breast cancer in the past.
What are some of the most effective tests for detecting and diagnosing breast cancer being offered at Bay State Health right now?
So the most common type of test that we use for breast cancer detection is mammography. And in recent years, mammography has developed and evolved a little bit into what is now called 3D mammography, or Tumor. And the way that this is better than the old school mammography is because it can analyze the breast tissue on multiple levels. So the radiologist can scan through this breast tissue and detect cancer that they might have missed before. You can also use ultrasound and certain diagnostic mammography techniques to take a closer look at areas that look suspicious. And then certain high-risk patients will even get screening with MRI, which is a very sensitive test and can detect a lot of things in the breast, not just cancerous, also benign disease.
It's something scary when somebody tells you that you do have breast cancer. What do you tell them to maybe calm them down and then eventually begin treatment? What are some ways to help with that?
Well, first of all, it's important to recognize that this is a scary disease and that this is a moment that will go along with emotions for the family and for the patient. And once that is a moment that is accepted for these patients, it's important to then determine what the best next steps are. And oftentimes we don't have the final answers at the first visit, but we have a general idea of what we want to do next. Are there tests that we could order, more imaging that might be necessary, or just more provider meetings that would happen in the patient's future. So having an overall plan and being able to tell that to the patient is important so that they don't feel alone in that moment of getting that diagnosis.
And a plan, of course, is step number one. All right, what are the latest treatment options for breast cancer patients? We'll have that discussion after the short break. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about breast cancer prevention and the latest treatments. Doctor, once a patient is diagnosed with breast cancer, what are the next steps for determining the best course for that treatment?
So after the diagnosis is made, a patient typically meets with one of the people that treat breast cancer, surgeons like myself or medical oncologists often. But in our institution, it usually is a surgeon. And what we then do is sit down with a patient and go through the pathology and through the imaging up to date to make sure that everyone knows what happened and what this all means. And then we put that into perspective and give them an outline of next steps, of other imaging that might be necessary, more testing that may have to be done, and also who the other people are that will be part of the treatment team.
So you have been diagnosed and now you are being treated. Who is involved in the patient treatment process team, and how often do they meet to discuss the patient's progress and make any changes?
So there's a myriad of people that are involved. There's surgeons, medical oncologists, and radiation oncologists. But then there are also additional physicians such as plastic surgeons or genetic counselors that can play a role as well. And what we typically do is that we touch base after new information has come back and then determine what the next best steps are. And this may be surgery, this may be medical therapy, this may be something else, this may be additional imaging or more testing that is necessary in order to know what we should be doing next. And sometimes even the whole team gets together in what is called a tumor board review, where we talk about challenging cases or things that are a little bit more unusual, or anything that is a little bit out of the norm. And this is where we decide what we should be doing and what we recommend to the patient that they have done next.
I know that the doctors are involved, the nurses are involved, but I'm also hearing that family is also very important to be involved as well in this whole treatment and recovery process, right?
Absolutely. The family or any kind of support system is crucial to have on board because patients need support as they go through this treatment. This often can involve a lot of months or maybe even years of treatment. And having someone there to know what to expect and to be a second set of eyes and ears as the patient meets with providers is really important. Sometimes even the information that we get is important for the family, especially if there's genetic testing that came back positive. All of a sudden the family member might become a patient as well. And so being very inclusive is crucial to the treatment of breast cancer.
And just to have that comfort as well, I'm sure is also very important. Does all patients require surgery or a mastectomy?
So while not every patient will require a mastectomy, most patients get recommended to have surgery, and that can be a partial mastectomy or what is also called a lumpectomy or breast conservation, which means the breast is preserved while the cancer is resected. And whether or not patients qualify for mastectomy or partial mastectomy or have the choice between both is usually dependent on the type of cancer and the size of the cancer and the size of the breast. And the surgeon will go through that with the patient. In very rare cases, surgery is not recommended when, for instance, it would be too risky for the patient to have surgery. And in this case, medical therapy can be used exclusively oftentimes.
I want to talk about immunotherapy, what it is and how it works, and are you seeing any success with this treatment?
So to understand how immunotherapy works, first of all, it's important to understand how cancer shuts off the body's immune system. It has certain parts of the cell that it changes so that it can evade the immune system, which is basically the body's own police that would treat these cancer cells. And immunotherapy now reverses that process and allows the body's immune system to recognize these cancer cells as something that should be attacked and something that should be treated. So it is very new. It's only been there since I think 2014. But as of now, it's very promising. Not every patient will qualify for it. In fact, the majority of breast cancer patients nowadays don't. But the ones that do, we've seen good success with it.
You've mentioned that there are many treatments out there for breast cancer, but are there some other recent breakthroughs in breast cancer treatment that are being used at the breast center?
Yes, of course. Breast cancer surgery and breast cancer treatment has evolved through the years. And so while, In the 1970s and 1980s, everyone who had breast cancer had their breast removed, and oftentimes the overlying skin and all of the lymph nodes in the armpit, and sometimes even the muscle underneath. Nowadays, we've gotten a lot more selective about what we do. So that individualized approach to breast cancer care has kind of become a lot more favorable. And nowadays, patients often can get away with very minimal surgery where we preserve the breast, or when a patient needs mastectomy, they might be able to preserve the nipple and most of their skin and have immediate reconstruction. We've also gotten less likely to remove all of the lymph nodes in the armpit to minimize complications. And same thing is true for medical therapy. We're a lot more selective, and we'd like to choose the treatment that we know will work for the type of cancer that the patient has.
How fast are these treatments evolving? Are you happy with the way, at least the timeline of treatments getting better?
I think the way that breast cancer therapies have evolved has been faster than any other cancers. Luckily, we've had a lot of motivated, excellent researchers out there willing to investigate and to do well-balanced, randomized prospective trials to help get this knowledge and then put it into practice. So I'm very happy with that, and I think we'll be seeing more exciting developments in the future.
And does treatment also include wellness therapies such as mental health awareness counseling and maybe even some group therapy?
Oh, absolutely. And it's really important to know that it's not just the cancer that we treat, it's the whole patient. And these modalities can be really, really helpful for patients. Not everyone will respond to everything. For instance, while some patients really enjoy having a massage, others do not like that at all. And so again, you want to talk to the patient and figure out what it is that you can offer them, and then connect them with other services like our social workers or our support groups to see what could be done next.
Well, this year's Rays of Hope Walk and Run is back in person. We'll have the details when we return. You're watching 22 News in Focus. You're watching 22 News in Focus. Every year, thousands of events are held across the country to bring awareness and to raise money for medical research, education, and programs that support breast cancer patients. One of those events in our region is the Rays of Hope Walk and Run towards the cure of breast cancer, celebrating its 29th year. Here to talk about this year's event is Michelle Gracie, Manager of Events for the Bay State Health Foundation. All right, Michelle, so when is this year's event and how is it different from the past 2 years?
Hi, Nick. So this year's event is on Sunday, October 23rd. It's different from the past 2 years because this is our first in-person walk and run since 2019. And last year and in 2020, we did have a drive-through event, but we're so excited to be back in person. Seeing that sea of pink, it's just incredible.
How did the Bay State Health Foundation become involved with Rays of Hope?
So Rays of Hope was founded in 1994. Lucy Giugio Carvalho was diagnosed with breast cancer at the age of 37. And her nephew had actually done a walk out in California in her honor. And that really got her thinking. And it also made her aware that there wasn't a lot of comprehensive treatment options. There wasn't one place to go to kind of get all your treatment and information. So she actually worked with the Bay State Health, and that's how we actually created it was the Comprehensive Breast Center at the time. So since then, we've raised over $16.1 million, and it all stays local.
Where is that money going, specifically?
So the money stays local, as I said. It funds programs and services through the Bay State Health Breast Network. We also give money to the Rays of Hope Center for Breast Cancer Research, which is doing research on a local level. And we also provide services such as funding for no or low insurance patients for mastectomy or lymphedema garments. And we also provide funding and grants for programs out in the community, such as Cancer House of Hope and Livestrong programs at the YMCA of Greater Springfield and Greater Westfield.
What other programs does Rays of Hope fund?
as I mentioned, we do support community programs such as Cancer House of Hope and the Live Strong program at the YMCA. Those programs, the programs at the Cancer House of Hope are vast, and they include yoga or equine therapy, those type of things. And the Live Strong program actually offers a program for patients to get stronger, and it's like a 12-week program that they're allowed to participate in, as well as their family members.
These past 2 years, of course, we all know we've been dealing with COVID precautions, but again, as you mentioned, this year, this walk and run is in person. What are your expectations, and what are you hoping and looking forward to see from the community this year?
Well, as I said, we're really excited about having everyone come out again. We have this big sea of pink. We start at the Temple Bethel in Springfield. The walk and run goes through and around Forest Park and the area surrounding it. We're just looking forward to seeing all the people that have participated in the past. There's always a lot of hugging, a lot of laughter, and there's also a lot of remembrance for the people that we have lost to breast cancer.
Now, men can also get breast cancer. Can male patients participate in any of the programs?
Absolutely. They're welcome to participate in most of the programs that these community programs offer. And some family members are also invited to attend a lot of those programs.
And what about programs for families and caregivers?
Yeah, as I said, a lot of those programs family members can attend. Even the Live Strong program for cancer patients, they do offer families an opportunity to participate as well.
Michelle, give us the details about this year's event, when and where, and how people can still register.
So it's October 23rd, which is a Sunday. We start at the Temple Bethel in Springfield on Dickinson Street. And as I said, we wind through Forest Park and the surrounding community. The run starts off at 8:30 and the walk steps off at 10:30. We have a lot of programs in between. We have a stage program, we have entertainment along the route. It's a lot of fun. There's a lot of emotions. People can register online at baystatehealth.org/Rays of Hope. And they can also call our office at 413-794-8001.
This has been around for a while now. You mentioned 1994. In your years of being involved in this, what have you taken away?
Well, as a survivor, I've taken away a lot through being able to experience the programs that Rays of Hope does help fund and support. But also as a fundraiser and an event manager, I just see the amazing emotion that is brought out by such a gathering of people who come together for breast cancer because they're all touched in some way by it.
And of course,
it's just that and the sponsors who support us. It's just a big, huge community event, and we're all like kind of giving a big pink hug to the breast cancer patients and survivors who are in this community. And by the way, Rays of Hope considers anyone who is diagnosed with breast cancer, the day they're diagnosed, we consider them a survivor.
Well, since 1994, that's a long time, and I'm sure you are hoping for many years to come, even after 2022, right?
Yeah. Well, we've got our 30th anniversary coming up, Nick, so that's next year, so
it's a big year.
It's going to be a big one.
All right. Well, I'll have some final words after the break. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been talking about the diagnosis and treatment options for breast cancer through Bay State Health and this year's Rays of Hope Walk and Run. We want to thank all our guests for joining us and thank you for joining us at home. If you missed any of it, you can watch it in full on our website at wwlp.com. From all of us here at 22 News, have a great day.